with that, you tried the retail, you was a drug rep. But what made you want to go back to school and become a holistic doctor?
So I actually got my MBA first, and that was because Johnson and Johnson paid for it. And so once I was like, I'm gonna do this, I started doing some other like medical pharmaceutical sales type career moves. And then I just started like really thinking about holistic medicine probably about maybe almost 10 years ago now. I kind of saw that it could be a marriage between like what I was doing and actually being able to work within like a hospice care type setting. And I wanted to do that, like helping people that were end of life, that couldn't get to a point where, that were at a point where curative care was no longer an option, and just trying to figure out like what they could do in terms of like their diets and other holistic methods to help them with pain. And that's really what kind of piqued my interest. I actually saw someone else that was doing that, not in my state, but I was like, man, I think I can do that. And I decided to go back to school and just really kind of ran with it. People think that's strange because they're like, you're a pharmacist and then you believe in holistic medicine. But I mean, there really is a good marriage between the two, because I still believe there are times that, holistic medicine may not be the best option for people. So I think I have the best of both worlds. So that's kind of what made me make that switch. So
The thing is, I talk to my friends who are pharmacists as well. Either we on the fence with we don't take medicine at all, unless it's like an emergency, or they take it on a regular. It's
right.
one of the things is like we don't do it or we do it. One or the
Right.
other.
Right.
So with holistic medicine, what's some of the things that you can do or you tell your patients to do to kind of like get better, feel better?
So I always start with diet. So my first assessment with a patient, we're going through like everything that they eat. Typically, the food is the root of the problem. And then, I'm looking at like, okay, what do you eat? What do you do through the day? How do you exercise? Just try to get like a baseline of like what they do, what they're intaking. And then we look at medications that they may or may not have been prescribed. More often than not, I see a lot of patients that are just Googling things, buying a lot of things online, and they're just taking a bunch of things that probably are not best for them. And they're like, my friend Julie, she was taking this and blah, blah, blah. And I'm like, that might have worked great for her, but that's not what's best for you. So we're really looking at a full, just like, okay, what are you putting in your body? And that's kind of how I start my assessments off, like, looking at what you're eating, what you're taking, are you exercising? And then I come up with a plan for each patient based on like where they are with that in part of their life.
Like you said, that's mainly what a lot of things start at is what are you eating. You probably heard the Dr. Savy. I did some research on him, and that's one of the things he talked about, like like cleanses and things like that to really
Yeah,
clear out your body because your body's supposed to naturally heal itself.
absolutely. Absolutely. And I mean, I find that a lot of things that we can do holistically can enhance what we're doing in terms of the medication aspect, but a lot of people are just drowning out their body's voice. So you really don't know when you're actually in pain or if your body's telling you you're having some sort of side effects because you're just taking all this stuff or eating things that you're just always feeling full or you can't, so that is really the key. And that's sometimes my first two consults is, what did you eat? Let's go through that. And then like, this is what we're going to take out. And then usually the second visit, a lot of times they haven't taken any of those things out and they're still feeling the same. So we got to go through that all over again. But once we get through that, a lot of times, especially with our hypertension, you know, based patients, like a lot of it, you're taking the medication to manage things, but it's just a mirror. I mean, it's just a mask because you're not looking in the mirror at like what you're doing day to day, what you're putting in. So it's like, you're going to continuously be on this medication, and you don't have to be. So that's kind of what we're doing in my practice, is really assessing that person as an individual, and coming up with a comprehensive plan for them based on their needs.
Nice. What's the name of the practice?
Advanced Functional Wellness.
Functional Wellness in Houston, Texas, right?
It's in Houston, Texas. Yes.
Oh man. But that's one thing, making sure that people stick to like diets and things, because I've seen people get diagnosed with things like diabetes or pre-diabetic, and then
Right.
they get into a workout regimen, change their diet, and they come back a couple months later and they're completely off the medicine.
Absolutely. So that is like you hit it right on the nail, because it's like you do have to make that change. So especially with the people that I think most, when we have people that are like pre-diabetic, they're like, oh, but I'm not diabetic, I'm just pre. And I'm like, yeah, but you don't want to get there. So let's start. So, that's, I think the hardest thing is to get people to actually like change their diet and exercise, and exercise, so they actually feel better. So, and I think in particular with the minority community, sometimes we kind of have a harder time with that than some of the other communities. So I really try to, um, just because that's what your grandma ate and your mom ate doesn't mean that that's the way you have to eat. And I think sometimes we have a hard time with that, unfortunately.